So Laura, you've been involved in the healthcare industry for a long time. What do we need to do to achieve diversity across the healthcare industry?
So I think the interesting thing about the healthcare industry is there actually is pretty significant diversity across the industry, and certainly as it relates to the front lines within the healthcare space. Where the challenge lies is in
so front lines meaning people working as healthcare practitioners at various levels. Okay.
Healthcare practitioners, nurses, if you think about in hospital settings and healthcare proper, certainly significant amount of diversity. I think where the challenge lies as at the leadership level, executive tables, in the boards of these large organizations, large industry.
Right.
And so I think the real opportunity is for us to really be driving, diversity at that leadership level, but also diversity of thought at the leadership level, so that it's less about the numbers and more about the contributions and the opportunity to have a voice at the table.
So diversity of thought, that's a new idea. How do we achieve that?
I think it's about creating, an openness for those voices at the table, right? So the sort of strongest or most powerful, loudest voice at the table isn't necessarily driving the conversation, but, at leadership tables, in boardrooms, the opportunity being to create the open environment for all voices around the table, regardless of whether they're, the quietest voice or the minority voice in the room, to have an equal amount of airtime and an equal contribution to the conversation.
We talk about innovation in healthcare. You've been involved in a number of digital health businesses. Of course, we all want our healthcare to be digital, to be personalized. What's the roadmap for that to become a reality?
Yeah, I think the most important thing in personalizing the healthcare experience is to ensure that regardless of, the new startup in the healthcare space, or even, again, the largest institutions in the healthcare environment, continue to keep the customer at the forefront. So the end consumer, your end customer, at the forefront of the thinking as it relates to customer service, right? Which is in some cases a bit of a foreign concept in our healthcare system. And also in, process creation, product and feature creation. I think the biggest mistake, any digital health organization can make is to think that they sort of know more or they're ahead of their customer.
And customers are getting exposure to these things, a lot of these technologies for the first time.
Yes.
So making them welcoming is really important. What's your strategy at League to make it welcoming?
At League, we're very focused on the health benefits space. So it's interesting because our buyer, so our sort of client per se, is the plan sponsor or the HR executive that's purchasing the plan. But our, day-to-day consumer is the employee who's, getting access to that plan. And traditionally, health insurance, health benefits have been very reactive in nature. And, in some ways, access to the product is difficult for the consumer to get to. So it's minimal utilization, minimal engagement. We're really shifting that focus to try and drive daily, if not weekly, touch points with our consumers that are focused on proactive health management.
Over the course of your career, you've been able to identify and develop some really powerful mentor relationships. What advice would you have for young people looking to create those mentor dynamics?
Yeah, so I think networking is critical, and I've heard a lot lately mentioned about the difference between a mentor and a sponsor. So I think understanding the difference between those two types of individuals in your life and in your career is really important. For me, really had the opportunity early on to find a great sponsor who was a phenomenal champion for me in developing my career. And I guess what he sort of gave me early in my career was just opportunity. He gave me these platforms to really potentially fail or succeed, but put confidence in me that, I could do it. And I think recognize that I'm the type of person that likes to rise to a big challenge. So it was a great learning, right? In trusting in people and giving them the platform. And that's really what I'm trying to do with, young women that I meet today, young folks in our workforce who are really talented and just need that opportunity. They need that platform.